Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, if you draw a table about the galactorrhea risk stratification for atypical antipsychotics, galactorrhea risk stratifications for atypical antipsychotics. These can be divided into three types. One, we have high risk. Second, we have low risk, and we have no risk at all. So if you see high risk, this include risperidone, then we have risperidone and paliperidone. These are high risk, whereas low risk are esinapril, ilaperidone, olanzapine, quetiapine, esinapril, ilaperidone, olanzapine, quetiapine and ziprasidone. So these are low risk, whereas no risk is clozapine has no risk and aripiprazole has no risk, and we have brexpiprazole and finally cariprazine. So all these are high risk, low risk and almost no risk antipsychotics. Thank you for watching.
Thank you and thank you for watching.